Coronaviruses are a family of viruses which will cause illnesses like the cold, severe acute respiratory syndrome, SARS, and Middle East Respiratory Syndrome, MERS. In 2019, a replacement coronavirus was identified because the explanation for a disease outbreak that originated in China. The virus is now referred to as the Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. The disease it causes is named Coronavirus Disease 2019, COVID-19. In March 2020, the Planet Health Organization, WHO, declared the COVID-19 outbreak an epidemic. Public health groups, including the U.S. Centers for Disease Control and Prevention, CDC, and WHO, are monitoring the pandemic and posting updates on their websites. These groups have also issued recommendations for preventing and treating the illness. Symptoms, signs and symptoms of coronavirus disease 2019, COVID-19, may appear 2 to 14 days after exposure. This time after exposure and before having symptoms is named the time period. Common signs and symptoms can include fever, cough, tiredness. Other symptoms can include shortness of breath or difficulty breathing, muscle aches, chills, sore throat, loss of taste or smell, headache, chest pain.
Know how it spreads. There is currently no vaccine to stop coronavirus disease 2019, COVID-19. The best because of prevent illness is to avoid being exposed to this virus. The virus is assumed to spread mainly from person to person, between people that are in close contact with each other within about 6 feet, through respiratory droplets produced when an infected person coughs, sneezes or talks. These droplets can land within the mouths or noses of individuals who are nearby or possibly be inhaled into the lungs. Some recent studies have suggested that COVID-19 could also be spread by people that aren't showing symptoms. Everyone should hands wash icon. Wash your hands often with soap and water for a minimum of 20 seconds, especially after you've been during a public place, or after blowing your nose, coughing, or sneezing. If soap and water aren't readily available, use a hand sanitizer that contains a minimum of 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. People arrows icon. Avoid close contact. Avoid close contact with people that are sick, even inside your home. If possible, maintain 6 feet between the one that is sick and other household members. Put distance between yourself and people outside of your home. Remember that some people without symptoms could also be ready to spread virus. Stay at least 6 feet, about 2 arms length, from people. Do not gather in groups. Stay out of crowded places and avoid mass gatherings. Keeping distance from others is particularly important for people that are at higher risk of getting very sick. Bedside mask icon. Cover your mouth and nose with a cloth face cover when around others. You could spread COVID-19 to others albeit you are doing not feel sick. Everyone should wear a cloth face cover once they need to leave publicly, for instance to the grocery or to select up other necessities. Cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing, or is unconscious, incapacitated or otherwise unable to obviate the mask without assistance. The cloth face cover is supposed to guard people just in case you're infected. Do not use a face mask meant for a healthcare worker. Continue to keep about 6 feet between yourself et al. The cloth face cover isn't a substitute for social distancing. Box tissue icon. Cover coughs and sneezes. If you're during a private setting and don't wear your cloth face covering, remember to always cover your mouth and nose with a tissue once you cough or sneeze, or use the within of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for a minimum of 20 seconds. If soap and water aren't readily available, clean your hands with a hand sanitizer that contains a minimum of 60% alcohol. Cleaning icon. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water before disinfection.